If you've been diagnosed with a hip labral tear, then you've probably heard of Matt Su, founder of the Upright Health YouTube channel. He makes a very convincing argument for why surgery is pretty much completely unnecessary and even detrimental for people suffering from hip labral tears. He supports these claims with some studies and what seems to be a higher level of understanding of scientific research than even a lot of doctoral students, which is actually very impressive. This guy really seems to know his stuff and really know how to read research. But as a doctor of physical therapy, I do have several problems with the content he makes around the subject of hip labral tears. And as I've been reading and interacting with the people commenting on his videos, I've noticed some similar frustrations from his audience. In this video, I'm going to explain the problem with Upright Health's position on labral tear surgery and with the presentation of otherwise valuable information on the subject. And as a disclaimer, none of what I am about to present should be taken as an opinion on Matt Su as a human. I don't know him personally, so I can't draw conclusions as to his character. This is simply a critique of the content I have seen on labral tears from the Upright Health YouTube channel. And don't get me wrong, Upright Health videos actually helped me in my early stages of FAI and labral tear recovery. I actually purchased the early version of the FAI fix in my early 20s, almost 10 years ago. It didn't fix my hip pain from FAI, but it did give me a lot to think about and experiment with. And the channel as a whole offers some very good information on conservative treatments for labral tears. So again, my goal is not to attack Upright Health, but to address some problems that I believe are detrimental to the huge population of people suffering from labral tear pain. First, the channel has a strong position that surgery has practically no role in the treatment of labral tears and labral tear pain. This position is supported by some research that's broken down quite well for the audience who likely has not been taught how to read scientific research accurately themselves. However, the channel demonstrates a clear and extreme bias against labral tear surgeries. Of course, Upright Health promotes its DIY courses like the FAI Fix, so it makes sense from a business perspective to focus on the research that affirms this bias and kind of push to the side any research suggesting labral tear surgery is an effective treatment option. As I've said consistently on this channel and to my patients, exhaust your conservative treatments first, and if you aren't satisfied with the results, then surgery can be an answer for you. This kind of leads me into my other problem with Upright Health, the presentation of the information. The content is presented in a humorous and entertaining way, which I actually commend it for. It's difficult to make anatomy entertaining and easily digestible. However, the attitude presented towards physicians, surgeons, and other healthcare professionals is often disrespectful. Of course, the jokes are funny, but it also undermines the professionals who are actually doing a good job in helping people by making a hasty generalization. Not to mention, it subtly discourages the audience from going to these professionals, setting up negative expectations and lumping every practitioner into a stereotype of corrupt surgeon, uncaring physician, etc. And I'll be the first to admit, I have done this in the past as a younger, less experienced therapist. The problem here is that when this happens, patients may not even seek the treatment they need for their labral tears. Patients may attempt every conservative treatment they can, and if their symptoms don't improve enough for them to live a happy life, they'll probably think, I must be doing something wrong. There is something I am doing wrong because surgery doesn't work. This leads to more negative self-talk, rumination, and ultimately depressive symptoms, when in reality, perhaps what they needed was the labral tear repair that was so heavily discouraged. Again, exhaust conservative measures first, and then consider surgery. To reiterate, the Upright Health channel has really good information on exercises and techniques that can help alleviate and control symptoms caused by labral tears. But the channel's heavily biased position on labral tear surgery and the presentation of otherwise helpful and valuable information can also discourage patients from seeking the treatment they need and ultimately affect the mental health negatively. But what do you think? Let me know in the comments. I'd love to talk to you about it. And thanks for watching.